Good morning, Mr. Chair, Commissioners. What I handed out was just kind of our current update, so it kind of gives you the total numbers that we're seeing in Minnesota, the positive cases, that 2,470, and then the total deaths are 143. In Clay County, we have 62, although that number will change today because we have quite a few more that I'm getting a report on, so that number will go up somewhere in the 80s, I believe. And then you see we have 3 deaths now in Clay County. So the deaths were, the age ranges, 2 were in their 60s, and 1 was in the 70s as far as the age range. So, and then it lists the total number of hospitalizations, 602, and patients no longer needing to be isolated, 1,202. We also had some hospitalizations for some of our cases in Clay County as well. I believe there was 5 or 6 of those. And then the likely exposure, is the congregate living across the state and actually across the nation is kind of an area of concern. Once you get the virus circulating in there, the immunity is down in a lot of that population in congregate care, so long-term care, assisted living. So we see that kind of circulating pretty rapidly. And then community spread, of course, just like we talked about before. I believe last week we talked about the community spread. So, it's circulating in our area as it is across the nation. And then the second page was kind of the demographics, just interesting. The gender is kind of a almost an equal mix between male and female. In Clay County, you see the highest range for our cases are people in their 50s and 60s. So that's kind of where we're seeing total numbers. We have some teens, and of course we have all the way up to 80 plus. Then on the back page of this, it shows the demographics for the source of exposure in Clay County. So some are still unknown. The congregate living percentage is 19%. And then community, either an unknown contact, whether someone was in contact with a positive case, or the known contact. So there's the 9 and 12% for the community spread. So because the virus is so, it's so contagious that it's sometimes a challenge to even determine where someone may have been in positive contact with someone or in contact with a positive case. What public health is doing still is we are still providing essential services to those that are isolated or quarantined. I think I talked last week about Minnesota Department of Health is doing the contact tracing. So they're following up on any of the cases that are positive, and then also following up on those that have been in contact to provide information and to determine how many days they need to be isolated and quarantined. They had talked about if they develop a huge surge and they can't keep up. I believe they have 72 people doing this contact tracing across the state. They would look to public health, but so far they've been able to keep up, so we haven't been requested to take part in that contact tracing. That would be quite time consuming, and I'm not sure with the staffing I have now how we could attain that. So we'll see. I just talked with someone yesterday in epidemiology at the state, and so far they're keeping up okay, so we don't see that in the next week or two anyway. We also have some food baskets. I have a nurse that received some food baskets from the food pantry. So if there's a situation on a weekend or after hours and someone is isolated or quarantined, we could provide a kind of an emergency food basket for them. So we'd have a couple in our office, and then we did give the Sheriff's Department a couple just in case there's a need that somebody desperately needs food and they can't buy that. We also have nurses working with our congregate care. We have 2 facilities in Clay County that have cases, and so I have liaison nurses that are communicating with all of the congregate care, not just the 2 that are listed, but all of them across Clay County to make sure that they don't need some assistance or support with our case or with their cases. And then we can provide education. We're also working with our emergency manager to get personal protective equipment in case they need that, gowns, gloves, masks, those kinds of things. So we did run some out to a corporate care facility just yesterday. We have reduced number of clients in detox because we're finding that across our metro area, there's a number of cases that are circulating through some of our homeless population. And so we wanted to, because of our facility, we really don't have a place to quarantine or isolate an individual that comes in. And so we're just trying to maybe reduce the numbers. So if there is someone that becomes ill, that they, having 15 or 16, there's just no way they can social distance. And oftentimes they won't keep masks on if we offer masks. So it's very challenging to keep not only the clients safe in there, but the staff. So we talked about monitoring that on a daily basis, and I've talked with the detox director. So we will determine how many we can take in a given day. If they become positive or symptomatic, so if somebody has a fever or cough, respiratory symptoms, our only option for those in our detox facility is to bring them to the emergency room. And so we've done that a couple of times just because we can't take them and keep them safe and keep our staff safe. So we may limit our numbers. I don't think we'll go below 10. I think that's kind of our threshold where we feel like we can keep them at a safe distance, hopefully most of the time. So
what happens to the people above that? Where do they go?
Well, we often, even in cases where we're at 15 or 16 and can't take anymore, we notify dispatch and they let our law enforcement officials know. So they more than likely will end up in the emergency room and then sent from there. They do have hotel in Fargo, so they're able to take some of those individuals if they need a safe location to be, and they can isolate them, then they can keep them separated. We have also a facility in Clay County. I think I talked about this last week, and we have received funding, so we have a little over $100,000 in funding that we can pay for lodging for those that we need to isolate or quarantine, and then some supplies. So we have the facility, we have the security company. The only thing we don't have is a transport person. We've searched high and low for someone to do transports, so from our shelter to this facility or to get testing and back to the facility. So we're still in need of someone to transport. We so far have not used that. We haven't had anybody that needed to go into that facility yet, but we have some funding now that we can pay for that grant funding. So that's a good thing.
So we need one of those driverless cars.
Yeah.
So is that funding, do you apply for it as you need it, or did they already send you the money, or?
They already sent us the money.
And so what happens if you don't use it?
That's a good question. I haven't checked back with them if we don't use that, if we have to send it back. We'll see. We were able to buy, we did not have thermometers for those individuals that were in that facility, and so we were able to just, and thermometers are it's a premium to get a thermometer now. So we'll use that funding to get thermometers. We did find a source that we can find those, and we ordered those for those that may be in that facility. They'll need to check their temperature every day. So we're able to use that funding for some supplies like that. So any questions? I know I went through the information pretty fast, but kind of we're still working on the same process and working with the same. It keeps, we see the numbers continue to increase, and hopefully we'll peak at some point here in the next month. But
Kathy, I have a question.
Yes.
So when Governor Wolf and Governor Burgum give their updates and they talk about the cases in hospital or ICU, are border city residents counted on the North Dakota side or the Minnesota side? Is it based where their residence is? It's a little confusing for me.
Well, all of our testing with all of the clients we have in Clay County, they're being tested on the North Dakota side, so it's either through Essentia or Sanford. So that's the majority of the testing. Those results, or the tests actually, if they're through Sanford, sometimes they're sent to Sioux Falls, or they may be sent to Mayo. We're getting those test results back within 2 to 3 days, except for the high-risk people, and those are healthcare workers, hospitalized patients, and those in congregate living. So other than that, we're getting a pretty good turnaround rate. So those numbers that Sanford and Essentia, they're covering our region. So we are being covered through those healthcare facilities. Is that what you were
I think he wants
asking?
to know whether to go to Clay County or Cass County. To count, don't you, Jenny?
Well, I understand that if there's a positive person in Clay County, they're still being covered by the Sanford network. I get that, or Essentia network. My question is more in terms of the numbers of ICU patients that we're hearing the governor's update on. If there's a Clay County resident in a Cass County ICU, is that counted in North Dakota's ICU or the Clay County ICU?
Yeah, that is counted actually when they have the number of ICU patients in Sanford and Essentia. Those are the number of ICU covering both Clay County and Cass County.
Okay, so then I guess what my question more is, when Governor Walz gives the update on where Minnesota residents are in ICU, you're saying they wouldn't be covered in that number?
Correct, yes.
Okay.
He's covering the Minnesota healthcare system, so that is correct. They would not be covered in there.
Okay.
Go ahead, Kevin.
Thank you, Mr. I want to go back to a question that Commissioner Mojo asked you about last week. And this has to do with, she was asking about being able to identify maybe by communities. I'm going to go a little bit beyond that here in a second, but, your response was that's all handled by the state. It seems to me kind of interesting that when we watch the news, we can hear about certain businesses. There was a big one in a deal in Grand Forks, and there was a big deal with one in Sioux Falls, South Dakota. And why are some of them being identified and some are not? And I want to tell you why I asked that question. Our businesses right now, a lot of them are open to do things, and rightfully so, because we need to have groceries and those types of things. But it seems to me that in some areas where we know there's an outbreak, wouldn't it be in the public's best interest to know that? And again, so I'll follow up. So you had mentioned today, and this started off with, about the congregate care places. Mm-hmm. You said there's 2 in Clay County. I happen to know, and I had a media person reach out to me yesterday asking some questions, and I said that we're somewhat limited on what we can give out. But there's, one of these facilities, from what I've been told, is doing it on their own. They're updating on their website about, if there are cases and what they're doing. Bravo to them for doing that. In regards to congregate care, are families all well informed about what's going on in those places? Because I know some of them have complete lockdowns. I know I'm kind of all over the board here, but what I'm getting at is it seems to me that I, as an individual, if I know if there's a particular place that has a higher likelihood of asymptomatic, even for that matter, because we don't know where they are, mm-hmm. Right? We don't know where they are.
Right.
But chances are, if you've had cases from a particular place, the asymptomatic people are probably also around there. And I hear numbers of 30 to 40% of the people who have this are asymptomatic, which means there's no symptoms, but yet they're walking around and they can carry the contagious virus.
Correct.
Right?
Yes.
So the more we learn about this and the more we know where these things are, when we start talking about opening back up, which at some point in time we're going to have to do, how do we keep people informed if everything's this big secret? I guess that's.
Good questions.
Okay.
Yeah, and in Minnesota and some of the states are different in regards to their privacy and HIPAA requirements, although HIPAA's federal, but there's some variations.
Keep in mind, Kathy, I don't mean
Sure.
it, but
Yeah.
never once have I suggested that we give any names out.
Sure.
And that's
right.
what HIPAA's about.
Yep, right.
Okay.
Yep, names and cases. So, in fact, I just verified this, so I know that Commissioner Mojoak asked last week about letting some of the smaller communities know. And the reason why the Minnesota Department of Health is saying no to that is just they don't want the individuals targeted, for lack of a better word. So sometimes in smaller communities, you can determine who may be positive. Now, you made a good point about asymptomatic individuals. There are a lot of asymptomatic individuals out there. We don't know who they are because they don't have symptoms right now. And you can carry the virus at least 2 days before you develop symptoms. So that could be any one of us. That could be asymptomatic, and we can spread it because we don't feel ill, we don't have a fever, we have no respiratory symptoms, and we can still spread it to others. Because we don't know how large of a group that is, it's all over the place. So the best recommendation is that you act as if everybody could be infected. That's why they do the 6-foot distancing.
Right.
6-foot distancing is the only vaccine we have right now. There's no vaccine for this virus, so 6-foot distancing is our only measure, non-pharmaceutical measure that we have to avoid spreading it to others. And of course, I talked about the cloth masks because the N95s and the surgical masks are really, and there's a lot of need for those in the healthcare world. So we don't want to use up those masks, but the cloth masks will protect. If I'm asymptomatic and I'm wearing a cloth mask, I can protect any individual I may be meeting in the grocery store or anyplace else. I can protect them from getting a virus from me. I'm asymptomatic. I don't even know I have it. So the cloth mask can catch anything that you may sneeze, cough, even sometimes talking and spitting. But so the virus is all around. They want to protect the individuals. For instance, Minnesota Department of Health, through the Commissioner of Health, will determine who may have greater information. I verified with the Minnesota Department of Health just 2 days ago, or yesterday, I guess it's only Tuesday, whether we can give any further information. And the only public information we can provide is the numbers. We can provide the age ranges. We can provide the gender. We cannot provide a location. That will be given to some of the first responders through the Commissioner of Health. The governor has an executive order out there that there's some first responders that will get the addresses, and there's a process for all of that. Well, to get information in case they have to respond to some situation, and then they'll know if that's a positive case. So there's going to be a way to do that through the Department of Public Safety. So I'm limited as to even getting, I can tell you the majority of cases are in our metro area, but I can't give specific smaller community, I can't say how many may be in Dilworth or Glendon, any of the smaller communities. They're not allowing us to do that because, again, they want to protect the healthcare, the people that are positive and are dealing with this, and they want to protect individuals from having that information out there. It's an infectious disease, so our best bet is operate as if anyone could be infectious. Anyone could be carrying the virus. So it wouldn't really matter if you have a cluster in a small community if you're operating with that 6-foot distancing and that everyone may carry it.
Yeah, I'm a little frustrated here on this because we're all stuck at home, or majority, a lot of us are stuck at home, and we watch the news, and we'll see that individual mayors of cities know all their details. It's perfectly clear, the governor or the mayor of New York, you see him he knows everything. And I guess I'm from the standpoint that, at least some sort of an update maybe to the mayors of our cities is appropriate, so that they, it seems to me that when we talk about cleaning, how do we know where things need to be cleaned up? Is the public health notifying just the individual entity about the need for cleaning and that type of thing?
Right, if there's.
And why is it that some mayors in this country get to be informed and others don't?
And that's a good question. I'm not sure why the other states are doing that. We can't inform anyone. We have pretty stringent parameters in Minnesota. And so all I can release is what they've allowed me to release. So I'm bound by those requirements because
I'm not blaming
Yeah.
you, Kathy.
No,
Don't
I
get me wrong.
understand.
I just
Yeah.
find it frustrating, and the more limited information that's out there leaves a lot more to speculation and guessing, and it's frustrating to me that we're dealing with that. So I have one more thing that I want
Sure,
to talk to you
yeah.
about, and thank you for your answers, and I get that that's a higher level, but and it gets to be, there's going to be two things that are going to be critical moving forward when we open back up, and we hear it, and I agree with it. It's testing and contact tracing. And how are we going to be in Clay County? I'm concerned about what we do in Clay County.
Right.
And I think we should be planning for some sort of a plan to do contact tracing on our own within Clay County. And I know that puts a burden on you, but start looking at that, and I think you should be ready to come to us and say, what is it going to take? Because ultimately, I think if we're going to open back up, one of the things we're going to have to be able to do is, if there's a breakout, find it right away and go to those who've been potentially in harm's way. Instead of making everybody stay home again, right? That's the
Right.
purpose of that.
Right.
So how are we going to be ready for that? I don't see how in the world, Public Health Department in St. Paul or wherever the heck they are, is going to be able to do it for the entire state. If this virus is contagious as we say that it
Right.
is.
Right.
So,
Yes, and thank you for that, too. We actually are in conversations about that. We are not so naive to think, they say we don't need local public health. We don't need them to provide the contact tracing right now, but we are very confident that that may happen in the future. So we are definitely in conversations about who can provide that, how we can recruit individuals to
Okay.
make that happen. We've looked at, even students and the campuses that
yeah,
maybe can help.
and what is, I would imagine it's obviously been done in the past, and there's a method to that or a process.
Right.
And if we're going to have some college students coming in and doing it, what's the training time and all that?
Yes, and there is training. We do contact tracing, just so you know. We in public health do it all the time if we
Right.
have tuberculosis cases. And we have to do all the contact tracing of those that were exposed. So it'd be very similar to what they're doing now. So in public health, they're pretty familiar with that, but you're right, there'd be training required to get anyone up to speed for contact tracing. So we would consider that as well, to get ramped up if we needed to do some training. I know in Cass County, it's a little different because their state health department is so small that they require the public health agencies to help with that. So in Fargo-Cass Public Health, they are doing contact tracing, and I believe they've used students as well that they've trained up. So we would look for that opportunity if we could find students that would be willing to assist. Good question.
So on the testing piece now, some of these questions, I have people asking me too, so it's not
Yeah.
like it's just all my little
No,
swirls
absolutely.
going on in my head. But the testing, is there gonna become a time where some Clay County, for example, if there's a place where there's been known to be infections or positive cases, I guess is the way
Right.
they say it now, within a facility, wouldn't everybody else who works within that facility, wouldn't they be prime targets to want to test?
Yes.
Okay, so at what point, so right now that's not happening.
Not in most cases.
Yeah, and it's unfortunate. So at what point, for example, if we have a retail establishment here in Moorhead or a retail establishment in Hawley, and they determine that they've come up with a positive test or whatever, there might be a coworker who is very concerned about that because sitting at home, they might have a child with severe asthma. And so they want to get tested themselves. Right now, they're turned away.
You know, as they get more tests, they won't be, but they're doing the high-risk areas right now, and I know if there's, like, say, a number of cases in a long-term care facility, they will test those individuals that are in there, both residents and staff. In a retail establishment, I'm not sure how they'll work that out, depending on how many test kits they have at the time. So they're continually getting more test kits and more availability for, it'd be nice if everybody could get tested right now as they, as they want to, because they have been exposed to a positive. They just are not doing every single individual, and part of that is there is nothing, most of the people that we have in Clay County are recovering at home. So there really isn't anything other than making sure that they're hydrated. There's no medication for most of the individuals that are at home. They just need to be isolated and make sure they're not in contact with others. So as far as treatment protocols, there's really nothing until we get the vaccine and maybe some antivirals. There are clinical trials going on with some of the medication, and those are really for the most ill patients. Those are in hospitalization or ICU. So those trials are going on to see if that would lessen the severity, but they're not widespread yet for general use. But you're right, the more test kits we can receive, the more people can get tested.
Will we ever do any of that right out of our own public health facility?
It doesn't sound like it, because the healthcare facilities, they are providing that. Even the facility in Worthington that had the outbreak, Sanford provided all that testing. They went to the facility and provided the testing. So
I apologize for the questions, but I'm
Good information.
asking them on behalf of some other people too.
Absolutely,
So-
no.
And that last scenario I gave you was a reality about
Oh.
a person who is working in a facility. It happens to not be in Clay County, but close by.
Oh, sure.
And they've been told that if their individual with asthma gets this, won't be good.
Yeah.
And then there's no testing for it.
And that's tough. Those
Yeah.
are tough situations, because that is a reality,
Yeah.
and you want to protect your family. So, yeah, that's a hard one. The only thing they could do is wear the mask and hopefully not spread it. Even in your own home, wear a cloth mask. But
Well-
those are tough choices when there's not enough testing for everyone. I agree.
Well, thank you, Kathy, and
Yeah,
thank you
thank you
for
for the
what you're
questions.
doing. That's good, thank you.
No, thank you for the questions and for the
Yeah,
updates
thank
there.
you.
You got more stuff on that, or?
I think not. I think on tomorrow, we're going to have a press conference, as we do on Wednesdays, but it'll be virtual. So I believe Tim from IT is going to test that this afternoon and make sure, I believe we're going to be doing it in the IT conference room. So we'll be providing information, but it'll be virtual this time, so.
Commissioner Haney, do you go to that still, or?
I did it by telephone last week.
Okay, you give a report for Clay
Yes.
County? Good.
Yep.
Most of it was about the motor vehicle.
Oh,
It's kind of an update for all the things related to COVID-19.
And Mayor Judd is also part of that, so he provides updates, and then the Fargo and West Fargo. So this time now, they've decided to do it virtual, so.
Okay, any further questions? No, thank you, Kathy.
Okay, thank
Good
you.
update.
yeah, thank you,
Appreciate that.
Kathy.
Stay healthy.
Yeah, thanks, you too.